Vital signs. What your numbers mean and how to track them. Most of us grew up hearing 120/80 and 98.6, but the truth is simpler. Your vital signs are a pattern, not a single magic number. When you measure them the right way and watch how they change over time, you spot problems earlier and make better choices day to day. Let's walk through what each vital sign means in plain English, the common mistakes that skew results, and a straightforward plan you can follow at home. Heart rate. What it is, how many times your heart beats in 1 minute. Typical resting range for adults, about 60 to 100 beats per minute. Many fit people sit a little lower. How to check it right. Sit and rest for a few minutes first. Use your index and middle finger on the thumb side of your wrist. Don't use your thumb. It has its own pulse. If the beat feels steady, count for 30 seconds and double it. If it feels jumpy or uneven, count a full minute. What to notice? Consistently above 100 at rest can mean your body is stressed, dehydrated, in pain, or reacting to caffeine, meds. Consistently below 60 can be normal for active people. But if you feel dizzy, weak, or short of breath, that's not just fitness. Ask your clinician. Quick tip. Compare your pulse on a normal morning versus after coffee or a tough day. Patterns tell the story. Respiratory rate, breathing rate, what it is, how many breaths you take in 1 minute. Typical resting range, 12 to 20 breaths per minute. How to check it right. Sit relaxed and breathe normally. 1 breath equals a rise and a fall of your chest. Count for a full minute. Try not to perform your breathing, just be. What to notice? A steady rise in your resting rate, especially into the high 20 seconds, can be an early sign your body is working too hard to breathe. Oxygen saturation, SpO2. What it is, the percent of oxygen carried by your red blood cells, measured with a small finger device, pulse oximeter. Common healthy range, about 95 to 100% for most people at rest. Special note, some people with chronic lung conditions are safely kept a bit lower. Follow your clinician's target if that's you. How to check it right. Warm hands make better readings. Remove dark nail polish. Gel if the number seems off. If the number doesn't match how you feel fine, but it reads low, or you feel unwell and it reads high. Recheck on a different finger or hand after warming up. If it still doesn't make sense, that's a reason to call. Blood pressure, BP. Perhaps the most important and easily altered of all the vital signs. What it is, the pressure of blood on your artery walls. Read as top over bottom, for example, 120/80. Normal, under 120 and under 80 elevated, 120 to 129 and under 80 high stage 1, 130 to 139 or 80/89 high stage 2, 140 plus or 90 plus. How to check it right. This matters a lot. Rest quietly 5 minutes. No talking. Back supported, feet flat, legs uncrossed. Arms supported at heart level on a table or pillow. Use the correct cuff size for your arm. Too small reads high, too big reads low. Take 2 readings, 1 minute apart, and average them. What to notice? One random high number isn't a diagnosis. Trends matter. Morning, evening, averages over a week tell you far more than a single reading at the pharmacy. Temperature, what it is, your body's internal thermostat. Common oral range, roughly 97 to 99 degrees Fahrenheit, 36.1 to 37.2 degrees Celsius. It's normal to be a little cooler in the morning and higher in the evening. How to check it right. Use the same device and body site each time, oral versus ear versus forehead, so your numbers are comparable. Wait 15 to 30 minutes after hot, cold drinks. What to notice is less than or equal to 95 degrees Fahrenheit, 35 degrees Celsius is low and needs attention. A new fever or a temperature that doesn't match how you feel is worth watching, and if persistent or accompanied by other symptoms, worth a call. Pain, one of the most underreported vital sign. What it is, your body's alarm system. Only you can rate it. Simple scale, 0 to 10, where 0 is no pain and 10 is the worst you can imagine. How to use it well. Be honest and specific. Location, what it feels like, sharp, dull, throbbing, what makes it better, worse, and how it affects sleep or movement. Sudden, severe, or unusual pain, especially with chest pressure, shortness of breath, weakness on one side, or speech changes, needs urgent care. Common mistakes that skew your numbers: wrong blood pressure cuff size, or poor position. This is the has-shown reason for mystery high readings. Checking numbers when you're rushed, anxious, or talking. Give yourself 5 quiet minutes. Cold hands or nail products for pulse ox. Warm up and try a different finger. Counting breaths while thinking about them. It changes your rhythm. Just relax and watch the chest rise, fall. Chasing a single odd reading. Always recheck and look at trends over days, not minutes. Your 4-week action plan to monitor vitals at home goal. Build a simple habit. Learn your personal baseline and spot meaningful changes early. What you need: automatic upper arm blood pressure monitor with a cuff that fits your arm. Basic digital thermometer. Pulse oximeter, finger, app, a notepad, or any health app, spreadsheet. Week 1, find your baseline morning and evening, 5 days this week. Blood pressure, sit 5 minutes. Take 2 readings 1 minute apart. Record the average. Heart rate, record what your BP device shows or count your pulse for 30 seconds and double it. Oxygen saturation, check once while seated and warm. Record. Temperature, check once at the same time each day. Evening is fine. 0 to 10 plus 1 sentence. Knee ache after walk. Note caffeine, alcohol, poor sleep, new meds, or extra stress on your log. These often explain blips. Week 2. Make it routine 3 days this week. Repeat the morning, evening routine above. Add a midday pulse and oxygen check on one of those days if you can. Start noticing patterns, for example, BP higher on rushed mornings. Week 3. Small tweaks, big payoff test. 1 gentle change. And watch the numbers for 3-4 days. 10-15 minute walk after dinner, or cut salty snacks by half. Or move your last coffee earlier by 2-3 hours. Or add a 5-minute wind down before bed. Keep logging like week 2. Week 4. Review and personalize. Look at your averages, not just individual readings. Circle any trend. Steadily rising pulse, evening, blood pressure always higher, oxygen dipping with colds, etc. Write your baseline. My calm morning BP sits around 120 over 80, pulse 75. My evening is usually 140 over 85, pulse 68. Oxygen at rest, 95% when I feel fine. Typical temp of 98 degrees Fahrenheit at 9 p.m. Share this summary at your next checkup. When to recheck, call, or seek help recheck if BP looks way off your normal. Repeat after 5 quiet minutes with the arms supported. Pulse ox seems low but your hands are cold. Warm up, try another finger, then recheck. Call your clinician soon if your week-long average BP is 130 over 80 or higher, or your resting heart rate is consistently above 100 and you're not sick or caffeinated. Your oxygen at rest is repeatedly below your usual or under 90% for most healthy adults, and you feel more short of breath than normal. A new or changing pain is affecting sleep or daily life. Get urgent care now if BP readings around 180 over 120 with headache, chest discomfort, vision changes, weakness, confusion, or shortness of breath. Oxygen is less than 90% at rest and you feel unwell. Chest pressure, one-sided weakness, trouble speaking, or severe shortness of breath, don't wait. This is general education, not a diagnosis. Always follow your own doctor's advice, especially if you have heart, lung, kidney, or metabolic conditions.